Hey, what's going on, guys? It's Justin with the New You, where we target those in the 55 plus community who are looking to lose 25 or more pounds. So if that's not you, hey, that's totally okay. Please stay and consume the free stuff. But if that is you, let's go. Let's get right into it. So what we're going to talk about today is blood testing methodologies, why they are not all created equal, and what is the right type of blood test for you to get for your hormones. So, for example, you got a couple different testing methodologies. Most blood work is an amino assay, a radio amino assay test, or potentially, ideally, we get an ECLI methodology, or even better, high sensitivity testing, which would be an LCMS test. So don't worry too much about the jargon of each test. Amino assay, radio amino assay are trash. We don't care about those. When it comes to your blood work, most blood panels that I've seen, you'll typically get your hormones done through the ECLI methodology. Now, the issue with the ECLI methodology is there's about a 30% variance, so it can swing or sway your blood work, and in turn, that'll affect how your practitioner is going to treat said blood work. So, for example, it's been a little bit now, it's been about 2 years, but I made this little estradiol graphic to kind of show where the therapeutic sweet spot is, and it's a great example because blood testing methodologies do have variance, and so it's a great way to see treatment options. So, for example, the same blood sample, I have the same exact blood sample tested through two different methodologies. So I use the ECLI-A methodology, so electrochemiluminescence amino assay. No, you do not have to remember that name, it's not that important. Just a more accurate assay. But the best would be high sensitivity testing, so an LCMS testing or liquid chromatography tandem mass spectrometry. And again, you don't need to remember the jargon, that's all it is. But ECLIA, LCMS. LCMS, high sensitivity testing, what we want for 110% accuracy. So let's get into it. Long time ago, I took that same blood sample, and through high sensitivity testing, so LCMS, I was at a 19. Okay, 19 picogram per milliliter. One outside of the therapeutic sweet spot, the beautiful reference range. Personally, I've seen men love the 15 to 35 range, so this isn't a 110% set. You might be a 15 individual and love it. You might also be an individual who sits at 35 and love it. But for the most people, for the general population, 20 to 30 is where you want to live. Okay, so my LCMS high sensitivity had me at a 19, so we know that's exactly where I was sitting at. It was truly a 19 picogram per milliliter estradiol. Now, my ECLI test, so my test it's not as accurate, has a little bit of variance, okay, put me at a 28. It was like a 28 something, and I'll pop those up here so you can see this, the same sample, same day, different testing methodologies. But it put me at about a 28, so almost 9 points full variance, so almost, let's call it 10. So 10 points of variance. Okay, so now let's just say, for example, that my accurate high sensitivity testing had me at a 29. Okay, so if it had me at a 29, and we know that ECLIA has 30% variance at least, then let's just assume that it puts me 10 points higher. So let's say I'm sitting at a 29, and it puts me at a 39. So my doctor gets my blood panel back, they're looking at it, they have the ECLI methodology, and it says my estradiol, which remember, is not all of our total estrogen. Estradiol is just your E2. So just a subsect of our estrogen, all right, says I'm at a 35. My doctor wants to treat me for high estrogen. Now, there's a couple things that he could do. Most doctors will probably want to give you some sort of estrogen blocker, AI, especially if you're an individual who is already on testosterone, okay? So let's say my real test is a 29 through LCMS, but my ECLI puts me at a 39. Well, my doctor is then going to try and treat me for high estradiol. So if they give me an aromatase inhibitor or some sort of estrogen blocker, what's that going to do? Well, it's going to suppress my estradiol and slowly bring me down. But if they're treating me for something that they think is over here, when in reality I am right in the middle, you run the risk of potentially getting pushed to the low section. So you don't want big drastic swings, and we want to make sure that we're being treated for exactly the issues that we're having. So I know it seems really small, it seems like a minute detail, because you're being proactive and you're going to get your blood work done and you're doing the things that proactive people do. But it's not like I expect you're not a doctor, you're not supposed to know. There's different testing methodologies, and you're not supposed to know there's variance, because we trust our medical practitioners, and typically you're not sitting there thinking, wow, they're trying to screw me, when in reality, they might not even know as well. So make sure you guys familiarize yourselves with testing methodologies. High sensitivity testing, LCMS, will always be better than inferior testing methodologies like ECLIA, amino assay, radio amino assay, etc. Okay, so for your hormones, we want LCMS, liquid chromatography tandem mass spectrometry, because you want to make sure that you're getting treated for exactly what you need to be getting treated for. We don't want to be treated for high estradiol when we're truly in the regular reference range, feeling great, living life, and then now all of a sudden we're dealing with low estradiol side effects from dry skin to orgasm, dehydration, low libido, irritability, mood swings, all the things, okay? And they are different. So if you're feeling any of these things and you haven't got your blood work done, make sure to be proactive. Remember, this is not medical advice. Talk to your doctor, always deal with your primary care practitioner, and make sure you're advocating for yourself as well, okay? No, you should not get used to the new normals, and if that is the type of information that you are, or if that is the type of conversation that you're having with your practitioners, I would always look into trying other things, okay? But I hope you guys have a great day. Hopefully you learned something, and if you want more free stuff, check out the-newyou.com, all right? And have a great day, guys.